Please contact the program coordinators whose contact number and mail ID are provided in the conference website. And if you have any queries regarding the presentation, please either put it in the chat box or unmute yourself and ask during the time provided for the same. Thank you.
Now, let's move on to the first technical session of the International Conference on Behavioral Nudges for Public Policies in India, Opportunities and Criticisms, organized by the Department of Commerce, University of Kerala. For this, we have with us Dr. Anirudh Taget, research author at the Department of Economics, Monk, Prayogshala, Mumbai. Dr. Anirudh holds an MSc in Economics from the University of Warwick and did his doctoral research at the IIT Bombay and Monash University Research Academy. He has previously worked with the World Resource Institute India and Institute of Rural Management, Anand. Dr. Anirudh's work has been published in Economic and Political Weekly, World Development Perspectives, the Journal of Behavioral Economics for Policy and India Review, and has been awarded grant funding from the Partnership for Economic Policy, National Council for Applied Economic Research, and the International Initiative for Impact Evaluation. He is currently the Deputy Editor at South Asia Research. His research interests include cross-cultural differences in decision-making, intra-household bargaining, and experimental economics.
First of all, let us invite Anirudh sir, who shall handle the session on behavioral insights, nudging, and choice architecture in India. Welcoming you, sir. Next, let us invite the moderator of the session, Professor Gabriel Simon Thattil, Head of the Department and Dean, Faculty of Commerce, University of Kerala. Professor Simon has over 28 years of teaching and research experience. He has successfully guided 25 PhDs and 49 MPhils. He has authored 3 books and has published 48 research articles. He is also the former General Secretary of the Indian Accounting Association and the current Chief Editor of the Indian Journal of Accounting. Moreover, he is a life member of the Indian Commerce Association, a professional member of the National Institute of Personal Management, and a member of All India Management Association. Professor Simon is currently the Director of Internal Quality Assurance Cell, University of Kerala. He is also a member of the Advisory Board on Kerala Institutional Ranking Framework of the Kerala State Higher Education Council and the State Quality Assurance Cell. I welcome Professor Gabriel Simon Thattil to moderate the session. Over to you, sir.
Thank you, Professor Anirudh, Dr. Biju, other distinguished guests who are there, who have joined us online for this workshop. We are moving into the first technical session on this theme that we now just saw in the inaugural part of it. We are looking at insights into nudges, choice of architecture. What actually is the whole issue of behavioral nudge? And what are the key factors which actually do reflect in terms of choices of decisions and being in the pursuit of eliciting the desired behavior. Some of these things we already saw. Now we are looking into the choice of an architecture that we actually have or that we could probably build in terms of nudges. Now, Professor Vijay Bhaskar was rightly talking about how the whole issue of nudges, in fact, happened and how he was actually influenced by a nudge in terms of joining this particular conference itself. Now, we have already looked into whether these things can be left as a matter of choice initially. We are going to further look into it in terms of insightful nudges, whether these nudges can be something which can be a matter of choice. If so, how this whole list or number of choices would stand open as far as the possible options which can be taken up for a desired behavioral change. And to deliberate on this, we have with us Professor Anirudh, who is a very experienced and a very scholarly person who has researched and written extensively on this. So, as the speaker, as the expert on this, it will be appropriate if he actually speaks, makes his presentation, and in my capacity as the moderator, I will sum up and take up more learning issues which can come from the audience or the participants on this talk. So I request Professor Anirudh to kindly take over and make his presentation on the theme. Over to you, sir.
Thank you. Thanks so much to Dr. Biju and then also Professor Simon for having me. I think that this is, very, very important initiative. I was, I was thinking back to maybe about three or 4 years ago when we had organized like a small workshop in Pune. My colleague Savita, who's Dr. Savita Kulkarni, who's here as well, she'll be presenting today afternoon. We had organized a small workshop, and there were about 20, 25 people who were maybe, enthusiasts of behavioral science at that point. And now it's actually really heartening to see this in this session by University of Kerala Department of Commerce that we have so many people here and asking many thoughtful questions. And I think big appreciation to you all for organizing this type of conference on behavioral science, on nudging, on choice architecture. And I think more than anything, providing, I think, a forum for people to get together and I think, discuss more on this subject. I think that's something that we don't have a lot of in India at the moment. So I think that in itself, I think is a great initiative. And of course, more than that, I'm very honored to be part of this and sort of, putting forward a little bit of how we've kind of seen the field grow. So let me maybe share my presentation, and I will, the way that this is kind of going to be structured is that I'll probably talk a little bit generally about nudging and choice architecture initially, and maybe provide a little bit in terms of guidance on what we understand to be nudging and choice architecture. So Professor Marishetti has already spoken quite a bit about behavioral science and nudging and things like that. So I won't spend too much time on that. And then I'll probably go into a few of the studies that we have done in this domain. And what I hope to maybe provide is not just I think it's not just sort of the success stories that I think that we should be discussing in terms of choice architecture or nudging or anything like that, especially in the Indian context. I think it's also the lessons. It's also trying to understand where we can go, moving forward, and that involves a lot more than just simply trying to understand, what is nudging, what is choice architecture, things like that. So need to be able to apply it to the specific context of India. So that's something that I will focus on. And I'll try and keep my talk somewhat shorter, in the sense that I would like to have a discussion. I would like to have some questions in case that comes up. Okay. So this is a sort of a broad outline that I've set up. So I'll talk about sort of 4 projects that we've worked on. One is sort of related, and each of them are in slightly different domains. 2 of them are in rural domains. One is on sanitation, and the other one is on women's empowerment and sort of intra-household bargaining. And the other 2 are in a more urban context, but they are also sort of in the domain of choice architecture and nudging and related to civic behavior, for lack of a better term. And of course, I'll have some time towards the end for feedback. Okay. So, as I was listening to the keynote talk, which was, very, very important, very interesting in terms of setting the context, it got me sort of thinking about how, when we talk about public policy, we often tend to forget that at the end of the day, at the other end of this public policy is actually an individual, right? So it's an individual like you and me. And this individual is trying to understand, this policy. How do we access benefits under a certain policy, or how do we if I want to work 50 days under Narega policy, then how do I do it, right? If I want to get rice under PDS scheme, how do I do it? Now, each of those decisions themselves are things that human beings make at the end of the day, right? So, and I think we've heard quite a bit already about how individuals as themselves are, a lot of work in behavioral economics and experimental economics has shown that um, some of the axioms of those types of decision making and preferences have been violated consistently. So more than anything, it makes sense for public policy to kind of think about how the individual to whom public policy is being targeted is not necessarily a fully rational sort of individual. Is there is a person at the other end of this policy that both as policymakers and as academics as well. It's important for us to think about how this person will react to these policies, right? And that's not just important in terms of trying to understand what kind of policies to design. It's also important in terms of trying to understand how do we evaluate the impact of these certain policies, right? So we want to understand how do individuals at the end of the day respond to these policies and how do we move them towards some better outcomes that we might have as a goal as policymakers, as academics, attempting to inform policy in some way or the other. So what I'm proposing, or rather what has been proposed already, it's not entirely new, is that we want to think about humanizing some of these policy approaches for lack of a better term. So we want to think about how do we situate the policy in terms of this new behavioral paradigm, so to speak. So one way is that the interventions that are often designed in policy are often based on what people consciously are thinking about. So most of the cases you will find in any public policy case, you will find that there is some information campaign or there is some awareness campaign, right? So most of those, next time whenever you see some sort of information campaign, and right now because we are living in the pandemic, you see a lot of campaigns targeted towards, say, vaccination, mask wearing, things like that, right? Now, one thing that you'll note is that these campaigns are not often targeted, right? So they are not saying that we will target people in X district or that we will target people, especially with this kind of messaging, in X city or in Y city, right? So the idea is that the implicit assumption in those kinds of policies is that all individuals will respond to this policy in exactly the same way, right? And that seems to be a bit of a reach in the sense that we know from behavioral economics, we know from other sort of fields and cognitive psychology, social psychology, that's not necessarily the case, right? So how much attention I pay to a particular problem or to a particular thing that's given to me, some sort of advertisement, some sort of some sort of newspaper advertisements, etc., is largely a function of kind of a lot of different things, especially the environment in which I'm looking at that information. So the case for behavioral science really comes in is because policymakers can potentially shape this behavior by focusing on the individual's automatic process. So I think just the debate that was going on in the earlier session about system one, system two thinking. So one of the appeal to public policy is that we need to think a little bit more seriously about what's happening in this automatic and intuitive sort of part of the reasoning. Just to sort of round out this, behavioral approach to public policy essentially recognizes that people can behave irrationally. They are sometimes inconsistent with their choices, and they're almost always affected by some factors in their environment, right? So I hope I'm not saying something entirely radical or something entirely new, because this is all work that's been established in behavioral science and behavioral economics. It kind of explicitly suggests that the prior approach, the standard neoclassical approach, in that sense, might be falling short on some of these domains. I'll show you a little bit more on this. So, Richard Thaler and Cass Sunstein, of course, the original sort of authors of nudge, as well as those who coined the term of libertarian paternalism. Basically, the idea encapsulates in a big way government approach to policy, but in a slightly different aspect. So the question is, can we make a decision maker better off without sort of disrupting or without sort of changing or restricting her decision set? So more than anything, we are concerned with limiting choice in some way. right? So when you think about um, bans, when you think about, say, people were using, say, for example, ivermectin or some other molnupiravir, some other drugs for treating hydroxychloroquine for treating COVID, right? So the government's response after some point in time, when it realized that these drugs were potentially harmful, was to basically ban this drug, right? So doctors were no longer sort of allowed to prescribe them. Um, so a ban is very different from a nudge, and the idea is that you're restricting the choice set of the decision maker in that sense by saying that you're knocking off one choice entirely, and you're saying that you can't choose ivermectin, you can't choose hydroxychloroquine anymore. Whereas a nudge is slightly different in that it attempts to sort of make the relative, how to say, salience of a particular choice more or less, depending on what kind of behavior it is that you want to trigger. So choice architecture really refers to altering the decision-making environment of the individual. I'm sure many of us might be aware from our own readings or from other sources that essentially you have the use of defaults. You have sort of all of these different aspects of nudging that has been highlighted, and I'll talk a little bit more as we go along. The most sort of popular example when it comes to nudging and choice architecture is, of course, the organ donation example, where essentially in the United States, they basically, at the time of signing up for a driver's license, you kind of have to indicate whether you would like to be an organ donor. And what happened was, not just in the United States, also in many countries in Europe. And what happened was that they changed the design in the form. Well, rather than having to tick in order to opt in to organ donation, what they did was to automatically uh, have people opt in and have them actually tick the box if they wanted to opt out. So this is an effortful sort of thing for people to do, because it means that they would have to read that entire statement. They would have to make the effort to sort of check the box and so on and so forth. So with the ultimate sort of social goal of having more people as organ donors, you could argue that having this type of default is something that potentially helps nudge people towards becoming organ donors without restricting their choice in any way, right? So you haven't restricted the fact that they can or they cannot be organ donors. You simply change the way in which they make that decision. Okay, so very popular, another popular example, just to sort of keep this conversation going. So many of you may have read about this, or you might have heard about this, but sort of the fly in the urinal is a very popular example. Well, basically to prevent spillage, and I think this was done first in Netherlands in an airport. Essentially found that a lot of individuals seem to be aiming better when you have this kind of intervention. And remember that this is choice architecture, because you aren't changing the choice that people have at the end of the day. So at the end of the day, you're not changing the design of the urinal, you're not changing sort of where toilets are, you're not changing other things. All you're doing is sort of introducing a very small sort of change in the decision-making environment, and lo and behold, it appears to have a very big sort of change in terms of hygiene, in terms of water usage. All of these things sort of change after this, and therefore now you may have seen this in many different parts of. I've seen it in India as well, but certainly I've seen it in other countries. Okay. So a bit of context. So, internationally, there's been sort of differences in terms of how people have approached nudging. So one thing is that you have this. This is kind of a side note to what we've been discussing, because so far we've talked a little bit in terms of setting up the definition or setting up the context of what a nudge or what choice architecture refers to. Now, who does the nudging? Right? So usually it's a government entity. Usually it's somebody associated with the government in some way or the other. Right. So the way in which, and a lot of this is drawn off actually a very early article that I'd written with my colleague Soumya Rao. And essentially in our article in Mint, I think sometime in 2015 or 2016, we basically laid out some of the approaches through which India could set up a nudge unit, for example, right? So all of that drew from this research from Dilip Soman, who's at the University of Toronto, other sort of researchers in behavioral science. So there are kind of two ways in which we can think about the government, trying to set up a systematic approach to choice architecture and nudging. So one is a structured approach, which is where you set up an organization within or around the government. So for example, in the United Kingdom, you have the Behavioral Insights Unit, which was initially situated in the cabinet of the Prime Minister of the United Kingdom. So in that sense, you have this core organization that's working from within the government and that's making some sort of inroads into incorporating behavioral science in some way or the other. The other is to do this organic approach. So each government department has individuals implementing behaviorally informed. So it's a more of a how to say a democratized sort of approach in the sense that okay, so somebody in the income tax department thinks that maybe we should do some nudges. Okay, so they can go ahead and do some nudges. Somebody in the child welfare department thinks that nudging will help them reduce child trafficking or something like that. They can go ahead and do something. So there's no sort of central authority that decides whether or not there should be nudge and how the nudge should be designed, what kind of choice architecture we should do. It kind of happens bottom up. That's one way to think about it. And the same with states, by the way, I should say that. So in case, government of Kerala decides to sort of set up a nudge unit or a particular sort of division within government of Kerala decides to do something in terms of a nudge or a behaviorally informed intervention, then there's sort of more of a bottom-up approach. You don't have the government sort of enacting a law or enacting some sort of, ordinance or something else saying that we should all do behavioral science interventions, right? So different models work in different countries in the sense that there's no gold standard there. In Germany, for example, you have a centralized nudge unit, something that works within the government. In UK, you have more of a decentralized. So many different organizations offer or not offer, rather they set up behavioral interventions on their own within different departments of the government. And in other countries such as Netherlands, you have more of a networked approach where different sort of, so some will be situated within the government, some will be situated within, say, private organization or some nonprofit, and they'll be sort of working with each other. I won't spend too much time on this because this is there in a very useful resource that came out by the University of Toronto by Philip Soman and colleagues. And it's called A Practitioner's Guide to Nudging. And I strongly recommend it to anyone who's trying to understand practically how do we go from thinking about choice architecture and nudging into actually implementing some of those things. So it has a lot of nice examples, has sort of different frameworks, different sort of taxonomy in terms of thinking. So do you want to have sort of a mindful nudge or a mindless nudge? Something where you want to trigger sort of automatic behavior or something where you want to trigger deliberate behavior, thinking about what they're doing, etc. Because it all applies in different contexts, right? So the so-called mantra for many behavioral scientists around the world is to say that context matters, right? So you'll hear this a lot, especially when you sort of now look at work in especially in other countries, especially say by the World Bank's behavioral insights unit, which is called Embed, and basically a lot of will be focused on how context is very important. So I think if you look at this resource, maybe I'll send the link towards the end of the talk. But if you look at this resource, sort of gives a very useful understanding of how do we incorporate context, because each problem, each behavioral issue is really a behavioral issue in of itself, and we can't apply like some sort of overall nudge theory or overall sort of choice architecture to all problems. We need to think about each problem individually, and sort of appreciate and sort of try to incorporate what is the one that would perhaps work the most. So this taxonomy is actually quite useful, and I'll talk about that a little bit more when I talk about some of our projects as well. This is so the OECD has sort of a public repository of institutions that are using behavioral science and nudging in some way. So you can I'll try and send the link to this as well. But this the map is kind of to give you an idea of where behavioral science is happening around the world, especially in relation to government projects or government sort of activities in that sense, more broadly public policy. And this map is interactive in the sense I can't put an interactive map in this slide, but when I send you the website, you can certainly have a look at it. And it'll give you an idea of all the different organizations that are working in this. There's certainly some in India that I'll talk about in the next slide. But the idea is that also the fact that they differ in terms of how do they operate. So do they operate within the government? Do they operate outside the government? Are they academic institutions? Are they private sector, for profit, and so on and so forth? Right. So that's something to just sort of give you again a little bit more context in terms of how nudging and choice architecture is finally implemented in this context. Just some institutions, in case you were sort of wondering what who is doing behavioral science and sort of nudging choice architecture in India. There are certainly a few organizations, and some of the work that I'll be talking about in a minute will kind of talk about some collaborations. But there's Busara Center for Behavioral Economics, which has its head office in Kenya, but does a lot of experiments and research in India as well. I know, for example, they're working on some issues related to privacy in the internet domain. So they're trying to understand sort of how do we design privacy policies, for example, that people will actually read at the end of the day instead of just skip forward from. The Center for Social and Behavior Change, CSPC at Ashoka University, is also a great sort of avenue to kind of think about. You can follow some of their work. They're now sort of formally engaged with the Niti Aayog to set up a behavioral insights unit, basically a nudge unit in New Delhi. So that's something to keep an eye on. I also sort of work, and you'll hear from Dr. Savita later today, where she's been doing sort of a lot of work in behavioral economics and trying to sort of integrate that with policy in some way or the other. As I said, one of the earliest workshops that we did on behavioral economics was in collaboration with GoPlay a few years ago. Okay, so the first sort of project that I want to speak about is related to Latino adoption in rural Odisha. So then this project was done sometime, I think in 16, 17, I'm sorry. So the context was that the Swachh Bharat Abhiyan had just been launched. And essentially what the government had done through Swachh Bharat Abhiyan was to basically build a lot of toilets, but it had not done very much for getting people to actually use these toilets at the end of the day. So many households had subsidies to build toilets, but very few of them actually had incentives to finally use these toilets, right? So simply increasing coverage itself did not promote lateral usage. And there are many sort of contextual factors. So in response to this call from the International Initiative for Impact Evaluation, 3IE, my colleagues, so Maria Laura is Sedlas in Argentina and Habiba Jabari at Marseille in France, and my colleague Hansika, we were basically working on this problem of Latino adoption in rural Odisha, and we were trying to come up with a behavioral intervention that basically helps kind of improve Latino adoption in this context. We partnered with a local sort of NGO, which is actually not a local NGO. It's a very big NGO called Gram Vikas. And Gram Vikas does a lot of work in sanitation around India as well as internationally. And the reason that Odisha was particularly important example for us is because it actually had the lowest open defecation free rate at that point in time. So it was only about 6 or 7% of villages that had ever been declared ODF. But ever since they started building more toilets, and there were some big improvements in that figure, but it was still much lower than the national average. So it was still very much below what the targets were. And the government of India was also concerned that perhaps it would not be able to meet some of those goals that it had set up. Okay. So useful when we're talking about behavioral science, when we're talking about what it is that we're trying, what kind of behavior it is that we're trying to encourage, useful to have context, right? So some pictures of what a toilet in rural Odisha sort of looked like in terms of what was being constructed by the NGO that we partnered with, which was Gram Vikas. Now, there was already a lot of work from behavioral science that sort of talked about how there were many complex sort of behavioral things that were going on in this context. So one thing is that there are a lot of cultural beliefs that intersect with caste, right? So ritual purity, masculinity. So I go out and defecate in the open because it's sort of the the manly thing to do, or it's something that gives me a feeling of being healthy and being sort of and it's also more convenient and things like that. So this is already researched by Dan Coffey and colleagues, demographers had already shown. There were also prevalent sort of social norms, right? So in the sense that going out in the open to defecate was already a social norm. Many individuals in their village or in their particular sort of social circle were already doing this. Right. So in that sense, for us to go and then build a toilet and then suddenly start using it would go against that social norm. Right. And there's lots of, finer sort of subplots, so to speak, which, suggest that, for example, women who you could argue were at risk of sort of say, violence or assault or something if they were going out to defecate in the open. But they also actually, the truth was that the reason that many women actually choose to go out and defecate in the open was actually because they found time to socialize outside of time from their sort of household chores and things like that, right? So the issue itself is actually far more complex than simply a question of, giving subsidies and saying you build the toilets and we will find that Odisha is open defecation free in a few years, right? So we want to understand a little bit about what's going on at the village level, try and understand a little bit of the institutional factors. So what we did was to first do sort of qualitative study. And for any researchers who are out there, I'm sure I don't need to say it, but as an economist, we are not often trained in qualitative tools. So I think one of the main things that we should, I think, do a lot more of is actually focus on doing qualitative study, some sort of interviews or focus group discussions before going and designing a nudge, before going and designing a behavioral intervention. So that's something that's a main sort of takeaway from from the study. So we did these FGDs and we worked in sort of 3 different villages, and we were basically trying to understand what are the community level institutions. So what can we do at the community level that can encourage people to use latrines once they're constructed, basically challenging all these norms of, say, masculinity, challenging the social norms. So how can we overcome some of these things? Sorry, and what's more important is to find out actually who is that individual. So what does an individual at the community level look like who can actually, tell people that you should be using latrines, right? And it's more important that that individual themselves also uses latrines at the end. So it can't be that it's somebody who says that, okay, some panchayat pradhan who says, now go use latrines, and then they themselves sort of don't use latrines, right? So some of the key findings was that we found that there's a lot of difference in terms of community mobilization, which basically means again, most of you probably are aware of community mobilization because it's a big thing in Kerala in terms of the model of local governance. So I don't need to say too much about it, but in the sense that how communities are organized and how they sort of interact with each other, very key in this context. And in certain categories of people, we found that in like say elderly, disabled, like they said that it was actually not safe for them to go out in the open in sense for concerns of safety and things like that, or at certain times, right? So despite awareness of some of these, sort of health-related hazards, they still felt that only certain individuals were at risk from going out to defecate in the open. And more importantly than anything, at the community level, the citizens actually don't have one person who they can contact related to this. And so one of the common complaints that we heard was that the subsidy that was provided for constructing these toilets was actually quite low, and therefore, typically these toilets became storehouses very quickly, and people stopped using them and sort of, defaulted to going back out in the open. And the reason for that was that they're very poorly maintained. They don't have idea of sort of how to clean these toilets. They don't have sort of an idea of how to work with different individuals and like stakeholders who can give them this information. And actually, what we found was that the mason, so the person who actually helps construct these toilets, that person is actually a very useful sort of point of resource to tell people information about how to clean toilets, how to maintain them, how to sort of keep them. So that was something that came as a surprise because you wouldn't think that a person with technical expertise was the one that was missing at the community level. We would think that having a local village elderman or having a panchayat pradhan, having dominant caste person telling others. So we would think traditionally that those are the people with power in the community, right? But when designing a nudge, when trying to design a behavioral intervention, it's actually important to identify who is giving that information as well, right? So not so much just that we are giving some information, it's also that we are actually figuring out who is the right person to give this information. So this is kind of how we proceeded through it. We said would form a village water and sanitation committee. We would have these sort of group meetings and pledges, and kind of have people, have some buy-in to the fact that they would go back to defecating in the open, and then also have community monitoring itself. So within the community itself, people sort of start monitoring each other as to whether this person goes out to defecate in the open, whether they're using their latrine regularly, and so on and so forth. So we proposed an RCT on the basis of this. Unfortunately, we couldn't implement it the way that we wanted. But one of the main sort of insights from this is that there's a lot of value in thinking about this mixed methods approach when we're thinking about designing a nudge. Prior to designing a behavioral intervention or something like that, it's useful to have this sort of baseline formative study that just helps us. And during this formative study is to incorporate local policy as well. So, we spoke to local Swachh Bharat Abhiyan functionaries, local ministries of the line department of water and sanitation and things. So those were all important components. And the reason that I put this example first is actually because even though we didn't sort of go and do a large scale RCT or some sort of behavioral intervention, it still helped us come up with a plan to reach there in the first place. Okay. The second thing, and this is more of a story on women's empowerment and sort of autonomy. And this is again joint work with Professor Savda Kulkarni and Hansika Kapoor, Dr. Hansika Kapoor. And basically, we worked on trying to design a field experiment, a lab in the field experiment in rural Tamil Nadu. And basically, one of the things that we were most interested in understanding is how does this program, which is the NREGA program, how does it sort of interact with women's empowerment in a particular context? Now, the reason that we approached this problem this way was because we know that a large chunk of person days, 33%, was already sort of mandated towards women. So women have to take up 33% of work days. Again, this study was done in 2015, I think, 2015, 16. So in that sense, maybe the mandate has changed. So we went to a couple of villages in 2 districts, but primarily in Dindigul district, where basically we saw a lot of female work days, and we also had a local partner, the Gandhigram Rural Institute, where we had sort of a wonderful team of collaborators who helped us implement this project. Now, again, there was a lot of research that was already done in terms of thinking about how to conceptualize empowerment in this case. So our behavioral problem was trying to actually understand how do we measure empowerment in this particular context. So one of the things that we were interested in is asking is whether participation in this program actually leads to some sort of change in decision making within the household, right? So this woman is going out and she's working in a particular program. She's gaining income that is in her own name. Back then as well as now, it used to go into their bank account directly. So we want to think about, what does that do to a female sort of decision-making autonomy within the household? Now, the particular method that we used was called, it's basically an artifactual sort of lab experiment in the sense that when we want to add more context to a particular behavioral problem, what we want to do is to basically enhance the context in that sort of situation. So what we did was to design a lab experiment, but then do it with individuals that were sort of of prime interest to us. The individuals themselves, actually, I'm going to skip over this. This is just some information from other programs and other studies that have done something similar. I can come back to it later if you like, but so basically what we did was to draw on this sort of bargaining theory and try to understand between a husband and a wife, how do they decide in terms of how to spend household resources, right? And this is a core problem in economics in the sense that, there have been different models of bargaining, different models of inter-household resource allocation. So there's one sort of class of models that says that it is a unitary model, which basically means that the household as a unit decides what is to be done with a certain set of resources. And then there is other, which is called a collective model of bargaining, right? So in a collective model of bargaining, which is one that we are appealing to in this experiment, kind of tries to say that there is a husband and a wife, for example, and between both of them, whose decisions are implemented more, and I'm speaking very roughly here, but whose decisions are implemented more is actually comes down to who has more bargaining power within that household. And one of these sort of standard conjectures is that, getting a new source of income or getting additional income from a new source such as MG and Rex is actually going to increase that bargaining power a little bit. So without any, prior information on what else it might be doing. So what we did was to design this experiment where basically we have and I'll show you some pictures of that, but basically we were trying to understand when does a woman sort of change her decision. And in one sort of group, which is the treatment group, we actually gave her information about what her husband was going to do. And her husband also got information on what she was going to do. And in the other group, they did not get to talk to, or in the sense, they did not get any information about the other person's choices, right? So our sort of conjecture was that in these households where both spouses are aware of what they want to do, there would perhaps be some more effect of this Narega income in that sense. Right? So how did we do it? We did a qualitative field study first. Again, as I mentioned before, this is sort of very important to do before you actually go out and start designing an experiment and getting people to come and participate in it. So we divided people into broadly 4 groups. One in which both of them participated in Narega, one in which only the man of the household participated in Narega, one in which only the female participated, and one in which neither of them participated. And of course, it's important to remember that we cannot randomize people, and I'm sure that this came up in the keynote talk, but we can't randomize people into Narega groups in the sense that we can't say, okay, in this household, both of them will participate, in this household, only one, because Narega itself is a welfare program, right? So we can't deny certain people welfare programs. So what we have to do is to just sort of account for it and try and study some differences. So again, useful to think about who our subjects, who our participants were, and how this experiment was done. So these are our sort of research as a field assistants from Gandhigram, and they were basically a husband and a wife were invited from each household to come and participate in the experiment. They provided sort of informed consent, and what they saw was this kind of they sort of make these decisions separately. So in the sense that we don't want them to sort of sit together and talk and decide what it is that we're more interested in, sort of individual preferences. So this is actually an example of what happens is the wife is sitting with one of our field assistants and she's trying to make a decision on what kind of things to buy. And the husband is doing the same thing in another corner of the room. So in this case, she was actually looking at her husband and trying to guess what he would do. So this is the setting that we did it in, because in most sort of rural contexts, we in order to implement a lab experiment, you need sort of a fairly controlled environment. The easiest thing for us to do was to use the school, because the school has benches, the school has sort of fans, other equipment and things. So that was where we decided to set up our experiment. So let me go back to this. So this is kind of the experimental shop that we had set up. So like you would expect to see at any other shop, you could see sort of these, there's a notebook here. This is some pain relief balm. This is rice, toothpaste, pen, salt, and all these other things. And all of them you can see have these little post-its, which are basically like the price tag. So in the sense, they tell them how much price they would pay in order to, and they each had 100 rupees to spend, and they could sort of pick and choose which one it is that they want to spend. Then we would exchange the sort of information that the wife had and the husband had with each other in one group, and in the other group we didn't do that. And then we would sort of compare whether or not this information exchange was actually in any way impacted by, say, Narega, for example, right? In households where only the woman might have worked in Narega, she might be able to sort of, say that, no, this is my decision and I'm not going to change it, regardless of what my husband wishes to do. And in the same way that, perhaps where both of them work, the dynamics might be different. So what we found was that, counterintuitively, the households where she was actually the sole participant in the program, she was actually more likely to sort of draw back from her initially stated preference. So that means that even though she was perhaps a sole participant in the program, it's possible that her husband was perhaps more employed in some other sector, maybe off-farm labor or working on their own farm, etc. So in that sense, she was actually less empowered in these contexts, if you go by our definition of empowerment. So she's actually going away from, so once she sees her husband's claim, she's actually trying to go away from her initial claim and lowering her financial allocation. I can share the paper link with you. It has a lot more details. So in interest of time, I will just sort of move forward to the next one. So one thing is that, one of the key things that we take away from this is being able to talk to policy directly. Right after we did this experiment, we engaged with the Ministry of Rural Development, Panchayati Raj in Tamil Nadu, and we basically gave them the results of some of these experiments, and we told them that, this means that we need to think about the households in which the female is the sole participant of Narega. We did a policy workshop in Chennai, sorry, and trying to also make the case for doing more of these types of experiments when it comes to thinking about policy aspects, beyond just the intended outcome. So the intended outcome of Narega is to basically, provide an insurance mechanism for households, right? When they're unable to perhaps find work in other domains, they can always come and secure 100 workplace under Narega. So the women's empowerment, sort of autonomy to women and things like that, these are all sort of second order outcomes that we can think of. But they're important things to think of when we try and think of policy. Okay, so just a couple more to go. So this is from a recent project that we did with an NGO called Project Mumbai. And essentially what we were trying to do here was to encourage youth voter registration in the city of Mumbai. So I don't think I need to talk too much about the problem, because I think we're all aware that youth voter rates, in both in terms of turnout as well as registrations, are actually quite low in many urban areas, especially. I'm not saying that in rural areas they're low, but certainly in urban areas they're quite low. And it's been shown in a variety of different contexts. Even in India, the Election Commission of India has done some surveys that basically suggest that a lot of it is due to indifference, related to politics, related to voting, and things like that. The second problem is that voting itself is not visible, right? So in a sense that we can't really, so we get a little mark on our fingers to show that we have voted, but other than that, the act of voting itself is kind of something that's difficult to tend to see the impact on, right? So it does not really help that people don't think very seriously about registering to vote for that, because you have two steps in the process, right? So one is the registration, and the second step is actually you need to go out and vote. And unless you registered first, you won't be allowed to vote. Now, in our local context, the voter turnout of students between, say, people who become newly eligible to register to vote was around 38%. And it went up to around 41% later on in 2018, around the time that we were doing, we did this experiment around 2019. So we were trying to understand then, in partnership with the State Election Commission as well as Project Mumbai, which is a civic action NGO. And basically what we were trying to do was to kind of figure out how we can design a nudge or design some sort of an intervention that might help us, improve these voter registration rates in that sense. And as luck would have it, there's already, some work in the psychological domain. There's some work in psychology as well as in political psychology that sort of says how do we increase voter registration within this very specific age group. So the thing that we considered was this thing called plan making. Now the psychological underpinning of that is kind of simple. It basically says that we all make plans to go out for dinner. We make plans to go out and perhaps buy groceries. We make plans to go out for a movie, things like that. So all of these activities require planning, right? So it's not something that we can just show up and we can do it. In the same way, can we perhaps get people to make a plan to register to vote? So it makes that entire process, it makes that entire action of registering to vote a little more salient, right? So it perhaps gets people to think about, when will I go to register to vote, and so on. So we asked them to make a plan to basically register to vote, and we did that at a very small scale. It was a pilot, but essentially we randomized at the level of colleges. So I'm sure it happens in Kerala as well, and in sort of other cities in Kerala as well. But in Mumbai, what typically happens is that around just before sort of maybe about 6 months, 8 months before election time, there'll be voter registration camps in colleges, right? So basically, Election Commission will partner with some colleges or with the NSS scheme or something like that, and they'll set up these voter registration desks at college. So what we told Project Mumbai was that, okay, have the voter registration test, but let's do something else on top of that. Let's do some nudge. Let's do some sort of behavioral intervention, because it gives us a unique opportunity to try and understand what's actually going on here. So we had about 20 colleges in which we could run the experiment, and out of which basically did randomization. So we randomly assigned 10 colleges to receive this plan making treatment plus the voter registration test, and 10 colleges that only got the voter registration test. Now, note on ethics here, because um, it would be sort of unethical for us to do just the plan making treatment, right? So, because all colleges would have either way or the other received voter registration tests because of policies from the state election commission. So having some college receive only plan making would perhaps not really make sense, because we're basically telling them make a plan to register to vote, but then we are not giving them an avenue to register to vote at the end of the day. So the two sort of groups that we decide to study are basically those that have the voter registration desk, then that have some voter registration desk plus the nudge or the behavioral intervention that we decide to do. So again, we had sort of partners in the national service scheme with the NSS volunteers at each college, where we trained them, and basically with the NGO, we trained them on how to deliver this intervention. And they were anyway going to be sitting at the voter registration desk and sort of registering people via the online portal that they have for basically uploading documents and putting in information. Um, what we measured was basically whether or not people who made a plan to register vote, I'll show you in a second what that plan making process looked like, whether the colleges that received this treatment were somehow different from the ones that did not receive this treatment. So this kind of summarizes how we went about it. Um, Kind of says, we had 10 treatment colleges, 10 control colleges, and we had 2 days in the treatment colleges and only 1 day. Well, we had more than 1 day in the control colleges. It's just that they did not get the plan making intervention. So this paper is published in the Journal of Behavioral Economics for Policy, JBEP. I'd be happy to sort of share the link at the end. So this is what we asked them to do. So they basically, our volunteers, NSS volunteers, they basically went around and they handed out these things. They said that we are doing a voter registration drive in our college. We are basically going to have, a voter registration desk to be set up. And please give us this information. Would you be interested in registering to vote? And then we basically, in the colleges which were in the treatment group, which received the plan making intervention, we gave them this card, right? So this was a printed card that we actually printed and we gave them. And on the front side, what you have is this, where basically we asked them sort of, will you register to vote? Or rather, when will you register to vote? We gave them an option of different slots. We sort of asked them what they'll be doing before they come to register. Who will you come with? Will you come with somebody? And then what will you do after registering? Right. So all of this sort of makes the event of registration itself far more salient. Right. So it gets you thinking about, okay, so I'm going to be in my class before I register to vote. I'll go with one of my friends, and then after registering, I'll maybe go out for lunch or I'll go out for a snack or whatever it is, right? So, but the idea is that it puts this voter registration thing right in the middle of all of these other things. And on the flip side, basically, we gave them this sort of documentation on what is needed, sort of a checklist that they could use, because they had to bring scanned copies on a pen drive or on their phone or something like that. Which were then uploaded into the portal. So one, of course, I should preface this by saying that it was a small pilot exercise. So in the sense, the estimates themselves are not powered in the sense that a traditional RCT would be. But essentially, we found some difference between the colleges that were in the plan making group versus the colleges that were in the control group. So you see sort of in both cases, both in terms of total registered and as well as the average registered in terms of the number of colleges that we finally implemented this intervention in. And we sort of see about a 33% difference, which is, we can't do a statistical significance test on it, but the idea is that we found some sort of evidence that this plan making seemed to be making a difference in the colleges where we did them versus the colleges in which they just had a usual sort of voter registration. Right. So, and there could be other things that could be driving these differences as well. It's not just that our plan making intervention was the one that was driving everything. So one of the things that we take away from this is that there were a lot of logistical challenges with sort of setting up this. So in one sense is that we need a lot of cooperation and a lot of support from the college itself, right? And in Mumbai, colleges in themselves are all under the University of, say, Mumbai, for example. But They each have their own administration, they each have their own principal, and all of these other things, which I'm sure is the case in other places as well. But the idea is that for each of them, we had to go and approach management and sort of tell them that, okay, so this is what we're going to do. We need your help. We need students' time. We need students to come up, and we need this particular space to set up. We need, this table. We need these chairs. We need internet. We need all of these things, right? So in that sense, it was kind of a big coordination challenge. So that's one thing that potentially prevents scaling up in a sort of smooth fashion. There's a lot of work in nudge and choice architecture today that sort of talks about how do we scale these nudges, right? And I think one of the things that we need to think about before scaling these types of nudges is actually having some sort of maybe central authority to sort of coordinate some of these logistical things. Um, so, the other thing is that there were sort of obvious sort of technical issues in terms of, uploading things on the portal and the portal being down for some time and things like that. So these are infrastructural things that need to be taken care of before we start thinking about nudges, before we start thinking about behavioral intervention. So you want to design a nudge or a behavioral intervention to encourage some behavior. But at the end of the day, you don't have the wherewithal or you don't have the sort of resources to actually help people engage in that behavior to begin with. So I want to register to vote, but then when I go to the website, I find that, oh, the website is down, or oh, the website is not accepting this file because it's too big, it's not in the correct format, the name is wrong or something like that, right? So we need to, take care of those things, make that process easy, so that then when we're finally doing a nudge, we are making it basically as easy as possible. So if you look at the EAST framework, right, that's very popular in behavioral science, it says basically make it easy and sort of attractive, social. So these are all aspects of an intervention that we need to think about before sort of designing a nudge as well. So this paper is in JBEP, and I'll try and send a whole bunch of links once we're done with this. So the last one that I want to talk about is a small pilot that we did on sort of encouraging plastic recycling and plastic waste segregation in Mumbai. So around 2018, Mumbai, as a city, basically the local municipal authority banned single-use plastic in the sense that, plastic bags, polythene bags, and things like that. Those were banned in sometime in 2018. So it meant that a lot of households were left with these plastic bags, which they had perhaps either collected or they had used recently, but then not thrown away, etc. And we didn't want them to basically then discard it in the dry waste, right? So because then we lose some opportunity to potentially actually recycle them or to dispose of them in a more environmentally friendly way. So the local development authorities, of course, have intentions to address this problem, but often have very limited bandwidth. And I think this can be true of any state government. It can be true of any municipal authority because more often than not, we are understaffed in our municipal corporations, even in panchayat levels and things like that. So to sort of expect them to pay attention to sort of a very specific problem would perhaps be asking a bit much. But we worked with basically this program, which was the Chief Minister's Fellowship Program. They have some fellows in Chief of Maharashtra, in the Chief Minister's, basically situated in the cabinet. They worked with them and essentially tried to think about how do we encourage people to segregate their plastic waste and then basically give it to us for recycling. So one of the things that's a very popular nudge or sort of a popular intervention in the behavioral science domain is this performance feedback intervention, which basically is a fancy way of saying that I will tell people how either they are doing or I will tell people how the entire community or some sort of group is doing in that sense. And the reason that that's supposed to work is because it's supposed to anchor people's behavior to a certain number, right? So tomorrow, if I were to say that on average attendance in say Dr. Biju's classes is 90%, right? So then all faculty in, say in the department would perhaps try to anchor themselves and try to figure out, okay, so where do I stand in relation to 90? I'm giving an example, by the way. So, where do I stand in terms of 90%, right? Which in a way implicitly anchors people to this 90% number, even if it may not actually be true, right? So I might be getting people try to attend more and more if that is the sort of ultimate goal. But simply giving them this information in a targeted way is meant to anchor their sort of expectations as well. So a lot of work by Christina Bicchieri, who is a philosopher at the University of Pennsylvania. She also talks about these kind of role of social norms and expectations. So this sort of performance feedback intervention really comes from there. And our plan was to essentially train residents to basically separate waste. So we had three labels that we gave them, and we gave them bags, especially sort of tag bags, and we said that so we gave them a list of items, and we basically instructed them where do they go. So this goes into wet waste, this goes into dry waste, and then this goes into plastic waste, and so on. And we trained them in essentially how to segregate this waste, how to clean it, and how to sort of discard it in a way that it can actually be recycled. So the question was, does providing this feedback provide actually some sort of impetus to do more of this plastic segregation behavior? Now, the feedback that we provided was actually at the household level. So we were working with a housing society in central Mumbai, and basically what happened was that we prior to the intervention, we basically measured people's plastic segregation behavior for about 4 weeks. So we were basically checking their bags to see if there was some plastic that went into the wet waste or some plastic that went into the dry waste for about 4 weeks. And then after week 4, what we did was to give them the feedback on how they were doing. So, and not just the feedback of how their household was doing, but also feedback on how the entire society was doing. So we said that your household correctly segregated 80% of waste in the past 4 weeks, and the whole society segregated about 60% of waste in the past 4 weeks. Or, your household segregated 0% of waste. So some household, doesn't care about plastic. So they just do whatever they want. And the society segregated about 60% of waste of plastic correctly. Right. So it kind of creates this anchor. And of course, it's not deception, right? So in the sense, it's not unethical. We're not creating this arbitrary number of 60%. It's actually something that this housing society actually does. Um, so the idea is that we will sort of think about how does providing this feedback perhaps change behavior in some way. Again, this is not a powered RCT; it's a very small pilot, but I thought that it's something that we could think about in terms of scale. And the surprising thing was, and I don't think that this gets talked about very much, is that the entire behavioral intervention actually backfired. So essentially, in the sense that the plastic waste segregation actually reduced after we provided this information. So there was this sort of how do we call it? It's basically called a backlash sort of effect, in the sense that in my household, I'm segregating 60% of plastic, and then I found out in the society that they're segregating 20% of plastic. I'll be like, oh, what difference does it make? Everyone in my society is only segregating 20%. Why should I take the effort to, sort of do more, right? So you basically you can also revise down um, your behavior or your desired behavior in some way or the other. Um, so yeah, I think that's something that as a finding was kind of surprising to us, and that it had a lot to do with also how we designed the intervention, how we sort of implemented it. There were a lot of implementation issues as well. So in that sense, it's something that I think that is worth thinking about when we're designing nudges as well. One of the main things that came out is that, of course, there's again, when it comes to sanitation, when it comes to waste management and things like that, there's also a lot of intersection with caste, right? So in the sense that typically in most households, there will be a domestic worker, or there'll be a house help who will perhaps do this segregation of waste, or who is responsible for disposing of the waste. It's not actually done by household members at the end of the day. Um, so targeting the intervention towards them might make more sense, but also at the same time, you would be reiterating these, sort of disadvantaged roles. You would be sort of saying that, okay, this is the person who is responsible for doing this behavior. So, it makes sense to target them. But you're reinforcing a lot of those sort of stereotypes. Um, Okay, well, I will try and wrap up now. So, just to sort of summarize, and some of these are from an article that Hansika and I wrote for the behavioral scientists, and you can, read more on that. But essentially, one of the things that we learned from, at least so far, from our experience of doing behavioral science, and trying to design nudges and choice architecture in India, is that the context matters, but not just for people who are being nudged. It certainly also matters for those doing the nudging. So does the local government agency, are they situated within the government? Are they situated outside the government? How much bandwidth do they have to do these things? Who can they coordinate with? All of these things matter, right? And they have a lot of enthusiasm in the sense that one of the main things that has come up in India in recent years is that there is a big sort of drive and enthusiasm to do behavioral science and policy, right? But that is only a necessary condition. That's not a sufficient condition. It's not enough to just have this enthusiasm or this kind of drive to do behavioral science. We also need to have the interest, right? So we also need to have the capacity. We also need to have the wherewithal to actually engage with the right stakeholders to be actually able to implement these nudges at the end of the day. Um, and that's where really, that's why I presented work from pilot experiments as well, because we have a lot to learn. I certainly learned a lot. So I hope that, some of those findings will be helpful for you as well as you sort of go through your own journey in terms of thinking about implementing behavioral science. And as is evident from, our own experience, there are certainly many challenges that can be addressed through behavioral science. But at the end of the day, it's important to think about them within that context. If we're going towards sort of building a nudge unit, doing all of these things, then we need to kind of keep that in mind as we go forward. So, yeah. So this is my email address. In case anyone wants to reach out, please do that. I'm also on Twitter in case anybody wants to sort of chat with me there. And thanks very much again to Professor Simon, to Dr. Bijil. Thanks so much for having me. And yeah, maybe we can have some time for questions and feedback.
Yeah, thank you. Thank you, Professor Anirudh, for your wonderful, insightful presentation. More so because it was based on actual research in terms of the example that you gave in terms of public health, the example of open defecation and the issue of latrines, women empowerment, voters, the youth, so on and so forth, how decisions are made. So this was what was actually presented in terms of the research examples. Now, I'll just some of my thoughts on this, which I will try to put across, because we are discussing choice architecture. And you were rightly saying that this choice is not only based on the group or the stakeholders for whom you made these nudges, but it's also based on those who actually make the nudges. Now, when you look at public health, when you look at in terms of say govern, when you talk about education, agriculture, and all, just the choice of architecture actually is it primarily should those choices be restricted or curtailed based on the nature of the persons for whom the nudge is being done? Or can you leave it widely at the choice of those who are making the nudges? So where do you think more relevance actually or more significance need to be attached? So in terms of the choice of the architecture.
Yeah. I think that in terms of, where the emphasis should lie, again, I will probably say it comes down to where the domain is or rather what domain is perhaps being targeted. I think, this practitioner's guide to nudging that I was referencing sort of clearly has different examples in which you can constrain choices or in which you can sort of expand choices. But I think in general, the framework for choice architecture is that we don't tend to really restrict choices in under any circumstances. So the idea is that we actually try and make certain options or certain choices perhaps less attractive by doing, lots of, for example, changing order, right? So in the sense we'll put, the one where we don't want you to sort of say, let's say that you have a savings form and you say that, okay, I will not save any money. That kind of option will be there at the bottom, which because we don't want to restrict people from saying that I don't want to save. Right? So it is ultimately people's choice if they don't want to save. But maybe as a government or maybe as a local agency, maybe it makes more sense for us to perhaps be the people who are guiding people in that sort of direction.
Just to add on to this, just to understand it, because the individuals or the society would benefit.
Mm-hmm.
But the problem that we have is when a policy is actually framed, it is more universal, it is more general in nature, and the stakeholders related to that would be often fragmented or segmented. So each individual in that framework of stakeholders are trying to look at it from their perspective. So we are now at on the verge of our budget. If you look at what happens when the budget comes, it's by and large a policy framework there. Uh, a housewife is trying to look at the budget only in terms of whether the price of cooking gas has been reduced or not. A salaried person will say, okay. What I was talking about is actually the budget, which is now just see analysis, and you see each stakeholder talking about the budget in terms of their perspective. Our house,
Yeah.
our salaried employees talking about the tax perspective and all. So when we talk about nudges, the same kind of thing happens because the person who actually is formulating the nudge or designing the nudge for a stakeholder in terms of one policy, you gave the example of latrines and open defecation and all. The the diverse perspective, how can it actually be taken in a very segmented perspective? So how is a nudge actually, how can you actually have a nudge in terms of a policy on that?
Yeah, I think that's a very important question. And thanks for raising that. I think that it's not. I think we need to perhaps cautiously stay away from the fact that behavioral science, nudging, choice architecture, all of these things can be implemented in a sort of umbrella approach. I think we need to keep thinking about those specific stakeholders. Who do we want to sort of, what kind of behavior do we expect in terms of certain stakeholders, certain specific stakeholders? And all of behavioral science is sort of, in that sense, at least most is kind of founded on, running these kinds of experiments. So I think the only way that we can really move in even a slight bit in that sense is by designing these targeted experiments at the end of the day. So each stakeholder should ideally be treated separately. And, I realize that brings in a lot of complexity. It brings in a lot of, chaos in terms of thinking about how do we implement these nudges. But I think as we do that, we are going to end up with either very null effects in terms of nudges, or we will think that okay, we implemented it for everybody, but overall we find no effects of this nudge, or we'll end up with some sort of false positive, in the sense we will ascribe to the nudge saying that okay, this actually helps do something, but then the truth will be that it may not have happened uniformly for everyone. Certain stakeholders may be left behind.
Exactly.
Yeah.
Exactly, because that's what I found out from some of the published literature on this. Like if you make something in an umbrella format and you have still their brackets on it. So thank you for that wonderful sharing on that also. Now I leave it to the audience for their comments there. And if there is anything in the chat box, Biju, please, you can read that also. Thank you.
Yeah.
Biju sir.
Yeah.
Yes, sir.
You can read it out. Questions.
Okay, sir.
Yeah.
So there is a question raised by Stalin A. He asked whether waste management design of plastic, paper, liquid waste in government offices and universities a classic example for a nudge design. And also he added whether these plastic waste and paper waste or liquid waste classification is a part of choice architecture.
Yeah. Thanks for raising that. It's certainly relevant to something that we were doing in our plastic recycling sort of nudge. I think that those are the reason that we also took it up in that context was because there is a lot of evidence in nudge theory and sort of broadly in choice architecture that sort of deals with precisely environmentally sustainable behaviors. It's more important as we go forward because I'm sure we're all aware of the threat of climate change and things like that. So using behavioral science to, I think, address some of those issues is certainly something that's quite important. And I think that how we classify, simply just changing the classification of certain, like you said, maybe creating some specific labels for different types of waste, even that is in itself a part of changing the decision-making framework, right? So basically, we're saying that, okay, do you want to dispose dry waste? Then do it in this bin, which is colored yellow. Do you want to discard plastic waste? Then do it in this bin, which is green. Do you want to discard wet waste? Then do it in this bin which is black, so on and so forth, right? So then automatically people start associating those colors with the kind of waste that they need to dispose, and they no longer have to, make a complex decision of, okay, this is a banana peel. Do I throw it in the yellow, green, or black bin? Right. At the end of the day, it becomes automatic for them to think about what's the appropriate way to dispose of this waste, rather than sort of doing. So I'll give you a contrast because you asked this question. The contrast to that is doing an awareness campaign where you say that, oh, banana should be thrown in wet waste, and this should be thrown in dry waste, this should be thrown in plastic, because that involves information that is difficult for individuals to process all at once, right? You're giving them 20 different things and you're saying that, okay, this will go here, this will go here, this will go here, as opposed to then giving just one piece of information which says that yellow box, plastic waste, black box, wet waste, or black box, banana peel, so on and so forth, right? So it's all about breaking down the information that we provide to individuals, because at the end of the day, as psychologists have been talking about really for, for many decades now, and economists are only beginning to understand that today, we're cognitive misers, right? So we don't want to take effort. We don't want to take the, sort of additional time and cognitive capacity to think through these problems. We want for it to be easy. So if you want for it to be easy, then, nudging and choice architecture are ways in which we can actually make environmentally sustainable options the easiest thing to do. And you'll suddenly find that people are perhaps doing more of the environmental sustainable thing to do. But thanks, Talent, for raising that question.
Sir,
More
I'm
questions?
Anna. Can I ask a question?
Yes.
Yeah.
It's a great session, and I have got some great insights on the practical side of this nudging. And I want to ask that we design nudges for a particular desired behavior, for developing a particular desired behavior. But when it becomes in practice, there may be some unintended effect also. It may create some spillovers. And when we are addressing the problem, we have to consider those spillover effects of these nudges also to our context. Is that necessary?
I think that's also an important point in terms of thinking about spillovers. I think even in I remember in our voter registration experiment, the way that we randomly assigned this plan making intervention to colleges. But it's entirely plausible that I say study in one college that got the plan making treatment, and then it's possible that my sister, who is around the same age as me, she got a plan. She did not get the plan making intervention at her college, right? So basically, then she starts thinking that, oh, where did you get this card from? What are you doing? So this is the way in which, unless we have, the only way to really address spillovers is through careful design of these interventions. There's unfortunately, I mean, post hoc, through some sort of data analysis, econometrics, etc., you could try and address it. But really, the cleanest way to account for these types of spillovers is to do it at the design level before you start, as far as possible, to try and account for as many sort of information leakages, spillovers, all of these things that could arise, because it's going to influence behavior in both groups, not necessarily only in the group that received your treatment or received your intervention, also in the one that did not receive the nudge or the treatment. So yeah, certainly looking at spillovers is important in the design stage.
So this plan making experiment, there is in one day we are making a plan to register for voter ID. And the next, then we can say that it is a lengthy process.
It is a stepwise process. Yes, it does have sort of more step in that sense. Yeah.
In that way, can we say that it is a nudge? The plan making can be seen as a nudge.
Yeah, in the sense that, it comes down to, when we're thinking about whether something is a nudge or not, it's useful to just think about whether it is changing the decision-making environment or changing the process of decision-making in some way or the other at the end of the day. So we are not perhaps so much interested in, so the choices that people have at the end of the day were the same. They could either register to vote or they could not register to vote. The only thing that we added in the middle was this whole, making a plan to register to vote, which even in treatment colleges where we had the plan making, people could decline that, right? So we could give them the card and they could say, actually, no, I don't want to do all this. I don't want to write all these details. I just want to register to vote, and I'll show up to the registration desk whenever I want. So the important thing is to have or when we're thinking about designing a nudge, or even thinking about whether a particular intervention is a nudge or not, is to think about whether we are restricting choices in any way, or if we're restricting certain behaviors in certain ways. And as long as we're not doing that, then we're still sort of golden, in the sense that we can think about how does this intervention have any intended or unintended sort of impact.
So, in defaults, that same or tomorrow program, in that case, I think the people are too lazy, or they won't give effort to analyze everything. So they prefer to take these defaults. And
Exactly.
when coming to this experiment, they have to give some effort
Yeah.
for 2 days. So how can we substantiate that this effortful activity can be seen as a nudge?
Because so in this guide that I sent on the guide to nudging, you'll actually see, so there are certain things where we want people to be effortful, where we want them to be deliberate in that sense. So it's not, yes, it does fly in the face of the understanding that people essentially don't want to take effort. They don't want to sort of do their cognitive misers and things like that. But at the end of the day, there are certain types of interventions that could exploit the fact that increasing the salience, even if it requires effort, is something that could actually lead to a desirable behavior at the end of the day. Um, that's actually a very good question, and that's the whole idea of conceptualizing a nudge as well, because it could be effortful, it could be mindless, because we want people to pay attention. At least in our case, we wanted people to pay attention to the fact that they're registering to vote, so that then eventually they would also turn out to vote, right? So the process of registration itself is fine. Like somebody gets a voter ID card, that's not very important in of itself. But what's also important is that you need that voter ID card, or you need to have registered to vote in order to actually then go and vote. So we want people to think about voting in a serious way. And currently, the way it stands, it was not happening. So that's why we sort of, did pick this particular type of intervention. But you could think of, yeah, you could certainly think of others as well, which are less effort. Yeah.
Okay, so then we can say that it is an evolution in the existing theory.
Yeah, in some way. Yeah. Yeah. I think you're
Okay,
being very sure.
okay, thank you, sir.
Yeah. Thank you.
So, any more questions?
Any more questions, either in the chat box or anybody wants to unmute and speak?
Yes, sir. Simon sir, Sanu, can I raise a question?
Yes.
Yeah, sure.
Sir, thank you, Anirudh sir, for your wonderful presentation. It was good. And you have mentioned about a lab in the field experiment methodology. All throughout your studies, if a methodology which can be underpinned that flows through all your studies, that would be lab in the field experiment. And in the earlier session, our keynote address, it was mentioned discrete choice experiment as a methodology. So would you see methodologically, these are two different methods, right? One more of qualitative thing. So what are the challenges you would experience when you apply this lab in the field experiment? It's a qualitative methodological study. So that's what my question. The earlier one would be more of a quantitative one. This is more
Right.
of a qualitative one. You have mentioned it. And what are the variants of this qualitative study? And how far would it be very effective in analyzing these behavioral elements for the nudging experiments?
Yeah. No, thanks. Thanks for raising that. So, one of the things is that lab in the field experiment is very much like any other experiment that we could think of. It's just that it happens in sort of a very specific contextual way. So, in that sense, it is actually still a quantitative exercise. But what I was actually referring to was also that we need qualitative work in order to inform the quantitative work. So, before we go and design these kind of lab in the field experiments, before we go and design I would say even the discrete choice experiments that Professor Vijay was talking about earlier, we need to have some sort of context about what is going on in the field prior to sort of designing these kinds of experiments. Because at the end of the day, so the lab in the field actually is a very now sort of mainstay in experimental methodology. Like because most of the lab experiments depend kind of extensively on student samples, right? So, for example, if I did a experiment here with everybody in this meeting, many of you would be students. we would get a certain set of results, say in a trust game or say in a public goods game or something like that. The other thing is that if I were to do the same experiment but with professors, or if I were to do the same experiment but with farmers, then I would perhaps get maybe some slightly different experiment, or maybe I would get the same sort of experiment. So the idea is that this lab in the field framework allows us to take the same experiment but take it to different sample, so different types of people, maybe who were interested in specific types of behavior. I think as Professor Vijay was also saying in his talk, he did these trust game and risk preferences and all these other things with farmers. Those were traditionally conducted with student samples prior to that. So bringing in that context and sort of allowing them to sort of, participate in these kinds of experiments allows us to say a little bit more about their specific behavior in their specific context. And I think that's why the lab in the field methodology, I think, is kind of appealing because it allows us to add context. We've been talking about how context is important in the behavioral science sort of domain, and how some experiment that they do in, among white Americans in the US is going to be very different from doing, say, a similar experiment in the Indian context, right? So the idea is that doing this kind of incremental work in terms of lab in the field experiment, I think that might be useful to be going forward. Thank you so much. Yeah.
Any more questions?
Thank you. So I believe there are no more questions. And your part, Dr. Biju?
Yeah, one question, sir. Sir, what about your suggestions to our researchers? They are looking for the finance nudges, fintech nudges and all. So how can they set the methodology part of these fintech nudges while they study?
I think, yeah, it's useful to think about behavior in the finance context because, if you think about savings, if you think about loan products, if you think about those kinds of things, we need to first understand, I think, how do people perceive these products? How do they sort of, engage with them in that sense? This was actually a big sort of issue that came up when microfinance was a big sort of, thing that was touted. And really today what you find is that, there's a lot of research that's been done on it, which suggests that microfinance doesn't have the kind of impact that it was originally touted as, being this poverty alleviation thing and all of that. Maybe it still does in some context, but, work by Abhijit Banerjee and colleagues and things actually found that it doesn't. So, but in the fintech context, actually, it's important to understand how do people interact with your product at the end of the day, right? So if you're partnering with maybe some organization or some startup or something else that has already developed an app or that has already sort of, maybe has some product or service that they want to offer. Then it's important to first understand how do people actually access, who are the kinds of people do they access and things like that before thinking about kind of a design sort of framework. One of the things that we might think about is how do we get people to use, for example, more of this particular fintech product or this particular fintech application, etc. So highlighting certain aspects of that app or highlighting certain aspects of that particular technology, like that is ultimately what will help change behavior or sort of move behavior towards a certain way. There's no, again, sort of one size fits all, I think, sort of design. But I think it's useful to think about all the usual things that we think about when we talk about financial behavior related to time preferences, related to risk preferences. So all of those things, I think, are trust preferences as well. So those are all, I think, pretty important when we talk about people who, we're trying to understand how they would deal with their money at the end of the day. And then you can think about specific features of an app or, sort of product that you can nudge or sort of use for encouraging uptake in that sense.
Thanks a lot, sir. Thanks, sir.
Yeah, thanks, Dr. Bidu.
Thank you, Mr. Anirudh Taget, for your wonderful presentation and sharing. Also on sharing the relevance of qualitative research, context-based research, behavioral research, and so on and so forth, which I think will help the researchers. So on behalf of the University of Kerala, as well as the Department of Commerce, sincere thanks to you. Sincere thanks to all the delegates who raised questions and who participated in this. Now I hand over the session to the organizers for the concluding remarks for this technical session 1. Thank you so much.
Thanks. Thanks so much, Professor Simon, and thanks, Dr. Bidu.
Thank you. Thank you.
Thank you, sir. It was truly an insightful session for all of us, and I must mention our deepest sense of appreciation for Dr. Anirudh Taget for his explanation on behavioral insights, nudges, and choice architecture in India. Thank you so much, sir, for such a wonderful session. I also extend my sincere thanks to Professor Gabriel Simon Thattil for being a great moderator for the session. Thank you so much, sir. And I also thank all the participants for their active participation and cooperation, and we expect the same in the coming sessions also. Thank you.
Thank you, sir. Thank you, sir, for the wonderful insights, especially the qualitative methodology and the
No.
real practical experience you have given. That's very insightful for the research scholars because they are doing these cross-sectional studies. So these cross-sectional studies, these kind of real insights, real research experience would be useful for them. Thank you, Dr. Anirudh, and thank you, Professor Simon Thattil, for the excellent remarks made in the sessions. Thank you.
Thanks so much, Dr. Vijay, and thanks everyone for listening to me. I'll be there in the afternoon session as well. So in case anyone has any questions, please do reach out to me, and happy to connect anytime.
Thanks a lot.
Thank you.
With this, we have reached the end of the first technical session. The next session will begin